Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about tick-borne encephalitis, which is also called TBE. First, we're going to talk a little bit about the disease, then we'll talk about the vaccine that's available. We'll discuss some common questions we receive here at the Vaccine Education Center, and we'll finish up with a conversation related to the relative risks and benefits. Tick-borne encephalitis is caused by a virus of the same name. It's a member of the family known as flaviviruses. So this family includes viruses that you may have heard of like dengue, Japanese encephalitis virus, West Nile virus, Zika virus, and yellow fever virus. The commonality that these viruses have is that they're spread through insects. Most commonly, they're spread by mosquitoes, but as you might have guessed, TBE, tick-borne encephalitis, is spread by the bite of a tick. This virus is not common in the United States. It mostly occurs in Europe and Asia. And over the last 23 years or so, we've only had about 12 cases of US travelers coming back with TBE after traveling. So you can think about maybe one case every 2 years. It's very uncommon in the United States. And this means that most people don't need a vaccine. But we'll talk about who needs a vaccine or is recommended to get a vaccine later on. Let's first talk about the disease. If you remember from our previous discussions, viruses need cells to reproduce. The owner of those cells is called the host. And people actually are not good hosts for TBE virus. And that's because they don't pass the virus to other people when they're infected, nor do ticks that bite an infected person get infected. So how does this virus survive then? If the virus is in an infected tick and that tick lays eggs, then the new ticks, the offspring ticks, can be also infected with TBE virus. But the virus also can infect other mammals. So it infects small mammals, particularly rodents, and it can also infect larger mammals like horses, cows, goats, sheep, even dogs. And in fact, when TBE virus infects some of these larger mammals, it can cause an issue for humans because if we consume unpasteurized dairy products from those infected animals, we can get the virus that way. About 1 in every 100 cases of TBE occurs after somebody consumes an unpasteurized dairy product from an infected animal. Now, when someone's exposed to the virus, it takes about 2 to 28 days for symptoms to appear if they're going to have symptoms. But on average, it's usually about 1 to 2 weeks after their initial exposure. It is shorter, however, if somebody is exposed to the virus when they consume unpasteurized dairy products. And in that case, they might develop their symptoms within 3 to 4 days. Now, if people have symptoms, and most people don't have symptoms, they can have 1 or 2 phases of symptoms. The first phase of symptoms tends to be flu-like. People are tired. They might have a headache, achy back and limbs, nausea, just feeling not well. Sometimes they'll have a fever, and that fever can get high. In particular, young children tend to get higher fevers. The symptoms from phase 1 typically last a few days, and then the person feels better for a period of a few weeks. If they're going to get symptoms during this second phase, they usually start with a high fever that develops, and then they have neurologic symptoms. So this can be confusion, memory loss, problems with attention or problem-solving skills. They can develop seizures or hallucinations or tremors, and sometimes they have paralysis of their limbs, lack of flexibility, or even difficulty moving. People who develop this second phase of symptoms are more likely to die from their infection, but the death rates vary from about 2 to 40 of every 100 people who have this infection. So now let's talk about the vaccine. In the United States, there's one TBE vaccine, and it became available in 2021. The TBE vaccine is known as an inactivated vaccine. What that means is that scientists took TBE virus and killed it with a chemical called formaldehyde. And it's against this dead virus that our immune system responds after vaccination to protect us from TBE virus. The vaccine is given as 3 doses that can take as short as 6 months, but can take longer than a year depending on the timing. And the dosing schedule varies a little bit by age. So if you think you might need this vaccine, the best thing to do is talk to your healthcare provider. One other note about the vaccine is if you're someone who might be in continuous contact or long-term exposure to this virus, then you can get a 4th dose at least 3 years after you've completed that first series of 3 doses. By now, you're probably wondering who should get this vaccine. And as mentioned before, most people in the United States do not need the TBE vaccine. Even most travelers don't need this vaccine. People can protect themselves against tick bites in the same ways that we do here in the United States. Wearing protective clothing, wearing insect repellent that contains DEET, and checking themselves for ticks after they've been outside. But some travelers will benefit from getting this vaccine. And that determination is made based on things like what time of year the person is traveling, how long their trip is going to be, how much time they'll be spending outside, particularly in wooded areas, like if they're going camping or hunting or fishing. The best thing to do in determining whether you could benefit from getting this vaccine is to talk to a travel medicine expert. On our webpage, Vaccine Considerations for Travelers, you can find a tool to help you locate a travel clinic near you. One other thing about this vaccine is that people who work with this virus in the lab can benefit from getting vaccinated, but people who are just handling clinical specimens generally don't need this vaccine. And as mentioned earlier, if someone's expected to be in continued exposure to this, either because of working with the virus or because of their international travel or their travel activities, they could also benefit from getting a booster dose about 3 years after they get their primary series. The side effects from this vaccine are minor. As with other shots, people may have pain or redness at the injection site. Children may get a fever or have a headache or feel restless. And adults may also have a headache or feel tired or have some muscle aches. But in all cases, these side effects resolve themselves within a few days. Now let's talk about some common questions that we get here at the Vaccine Education Center. Because this vaccine is not a routinely recommended vaccine, most healthcare providers and pharmacies don't stock this vaccine. So sometimes people wonder where they can get the TBE vaccine if they think they need it. And again, we would recommend talking to travel clinic experts, because travel clinics tend to stock these types of vaccines that are not routinely recommended. They may often have the vaccine. The other place you could check if you don't have a travel clinic near you or you aren't sure where to find a travel clinic is with your local health department, because they may be able to help you find a location near your home. Sometimes we have parents reach out and ask how can they protect their infant if they're traveling with them to an area that has TBE. So in this case, you would do things like we do in the United States to protect infants and others from tick bites. Have them wear long pants and long sleeves. It's recommended to have light-colored clothing because then the ticks are easier to see. Cover their feet with closed-toed shoes and socks, and you can tuck the pant legs into the socks so that ticks can't get to the skin around their ankles. You can use a hat, and if they have longer hair, you can pin that hair closer to their head so that ticks can't get in their hair or crawl towards their scalp. Now, some people wonder about using insect repellent. There are 3 things to know about using insect repellent when you're talking about infants. First, it's not recommended to use any insect repellent on infants less than 2 months of age. And even when an infant's slightly older, the amount of DEET should be limited to the lowest amount necessary. And finally, parents should not use the combination products that contain both insect repellent and sunscreen, because if the sunscreen needs to be reapplied, you don't want to have to continue to repeatedly apply the insect repellent. Okay, let's finish up with a quick consideration of the relative risks and benefits of TBE. Today we talked about the fact that most people in the United States are not at high risk for this virus, and therefore do not need to get vaccinated. But for some groups, they may benefit, such as laboratory workers who work with this virus on a regular basis, or some travelers based on their itineraries. We talked about the fact that the virus spreads through the bite of a tick or through the consumption of unpasteurized dairy products such as milk from infected animals. Most people are not symptomatic when they are infected with this virus, but for some they do experience this second phase of illness where they develop neurologic symptoms, and it's among that group of individuals where the risk of death is higher. We talked about the fact that there have been very few cases in the United States, less than 1 every 2 years when you look at the rates over the last 23 to 25 years. And we talked about the fact that the vaccine is safe. It's an inactivated or killed virus vaccine that causes very few side effects, and the side effects resolve within a few days. Taking all of this together, when our team looked at this information, we determined that if you're among the individuals who could benefit from this vaccine, that it would be worthwhile. But for most people, this vaccine is unnecessary. We hope after you review this information, you'll feel that way too. Thanks for listening today.